In the gaslit lecture halls of the University of Munich on a crisp October morning in 1892, one of Germany's most distinguished physicians would commit an act of scientific hubris so reckless that it would claim the life of his most devoted student and shatter his own reputation forever. Dr. Max von Pettenkofer, the towering figure of German hygiene and sanitation, raised a glass vial containing enough cholera bacteria to kill a dozen men and drank it deliberately, convinced that his theories about disease causation would protect him from death. His survival would embolden his young assistant, Dr. Rudolf Emmerich, to repeat the deadly experiment, a decision that would lead to 5 days of unimaginable agony as cholera liquefied his intestines and killed him screaming, while his mentor watched in horror, finally understanding that some scientific truths are written in blood. The German Empire of 1892 stood at the pinnacle of European scientific achievement, its universities and research institutions leading the world in medicine, chemistry, and physics. Munich, the capital of Bavaria and seat of the prestigious Ludwig Maximilian University, had become a center of medical innovation where some of the era's most brilliant minds gathered to push the boundaries of human knowledge. The city's broad boulevards, lined with neoclassical buildings and punctuated by magnificent churches, reflected the confidence of a nation that believed science could solve any problem and conquer any mystery. The University of Munich's medical faculty occupied a complex of imposing stone buildings near the city center, their lecture halls and laboratories equipped with the finest instruments that German engineering could provide. The anatomy theater, with its steep wooden benches rising in concentric circles around a central dissection table, had witnessed countless demonstrations of surgical technique and pathological discovery. The chemistry laboratories, filled with gleaming apparatus and the sharp odors of reagents, buzzed with the activity of researchers who were revolutionizing the understanding of biological processes. Within this temple of scientific progress, a fierce intellectual battle was raging between two competing theories of disease causation that would determine the future of medicine. On one side stood the traditional miasma theory, which held that diseases like cholera arose from bad air and environmental conditions. Corrupted soil, stagnant water, and atmospheric disturbances that created the perfect conditions for illness to flourish. On the other side was the revolutionary germ theory, proposed by scientists like Louis Pasteur and Robert Koch, which argued that specific microorganisms cause specific diseases and that these invisible enemies could be transmitted from person to person through direct contact or contaminated materials. Dr. Max von Pettenkofer, at 74 years old, was the undisputed champion of the miasma theory and one of Germany's most respected medical authorities. His work on sanitation and public health had transformed Munich from a disease-ridden medieval city into a model of urban hygiene, with clean water systems, efficient sewage disposal, and building codes that promoted healthy living conditions. His textbooks on hygiene were studied throughout Europe, and his theories about environmental factors in disease had shaped public health policy across the German Empire. Von Pettenkofer's opposition to the germ theory was not merely academic, it was deeply personal. He had devoted his entire career to proving that diseases arose from environmental conditions that could be controlled through proper sanitation and urban planning. The idea that invisible bacteria could cause disease regardless of environmental factors threatened to undermine everything he had worked to achieve and reduce his life's work to obsolete superstition. The immediate catalyst for von Pettenkofer's deadly experiment was the work of Dr. Robert Koch, the brilliant bacteriologist who had recently identified Vibrio cholerae as the causative agent of cholera. Koch's discovery, announced with great fanfare at the International Medical Congress in Berlin, had been hailed as a triumph of scientific method and a vindication of the germ theory. Koch had isolated the comma-shaped bacteria from the intestines of cholera victims, grown them in pure culture, and demonstrated their presence in contaminated water supplies that had caused cholera outbreaks. Von Pettenkofer viewed Koch's claims with deep skepticism and mounting anger. He argued that the mere presence of bacteria in cholera victims proved nothing about causation. The microorganisms might simply be opportunistic invaders that thrived in bodies already weakened by environmental factors. He pointed to cases where people had been exposed to cholera bacteria without becoming ill, and to outbreaks that seemed to follow patterns of soil moisture and atmospheric conditions rather than simple contagion. The scientific community was divided in its response to this controversy. Younger physicians, trained in the new bacteriological methods, were increasingly convinced by Koch's evidence and the growing body of research that supported the germ theory. Older practitioners, many of whom had built their careers on miasma theory, remained skeptical of claims that seemed to reduce the complex art of medicine to the simple identification of microscopic enemies. Dr. Rudolf Emmerich, von Pettenkofer's assistant and most devoted disciple, found himself caught between these competing worldviews. At 29, he was young enough to appreciate the elegance of bacteriological research, but his loyalty to his mentor and his respect for von Pettenkofer's achievements made him reluctant to abandon the theories that had guided his training. Emmerich had worked closely with von Pettenkofer for 5 years, assisting with research projects and helping to refine the environmental theory of disease causation. The relationship between von Pettenkofer and Emmerich was more than professional. It was almost paternal. The older physician had taken the young doctor under his wing, guiding his research and shaping his understanding of medical science. Emmerich, orphaned at a young age and raised by distant relatives, had found in von Pettenkofer the father figure he had always lacked. This emotional bond would prove fatal when it led Emmerich to follow his mentor into an experiment that should never have been attempted. The decision to drink cholera bacteria was not made impulsively. Von Pettenkofer had been planning such an experiment for months, convinced that it would provide definitive proof of his theories about disease causation. He believed that his own robust health, maintained through careful attention to diet, exercise, and environmental factors, would protect him from infection even when exposed to pure bacterial cultures. He also suspected that his advanced age might provide some immunity, as cholera typically affected younger individuals more severely than older ones. Von Pettenkofer's preparations for the experiment were meticulous and chilling in their deliberate precision. He obtained a pure culture of Vibrio cholerae from Koch's own laboratory, ensuring that the bacteria were virulent and capable of causing disease. He calculated the dosage carefully, choosing a concentration that was known to be lethal in animal experiments and had caused severe illness in accidental human exposures. He prepared detailed notes documenting his methodology and arranged for colleagues to monitor his condition throughout the experiment. On the morning of October 7, 1892, von Pettenkofer entered the main lecture hall of the University of Munich Medical School, where over 200 students and faculty members had gathered to witness what he promised would be a historic demonstration. The hall was filled with an atmosphere of excitement and dread, as word of the planned experiment had spread throughout the medical community. Some attendees came as supporters of von Pettenkofer's theories, eager to see the germ theory definitively refuted. Others arrived as skeptics, horrified by what they considered a reckless gamble with human life. Von Pettenkofer appeared calm and confident as he took his position at the podium, his white hair and beard giving him the appearance of a biblical patriarch about to deliver a divine revelation. He spoke for nearly an hour about the principles of hygiene and the environmental factors that he believed were the true causes of disease, building his argument methodically while the glass vial containing cholera bacteria sat prominently on the table before him. The climax of the lecture came when von Pettenkofer lifted the vial and explained its contents to the stunned audience. 1 cubic centimeter of pure Vibrio cholerae culture, containing millions of living bacteria. A dose that Koch's research suggested could kill multiple people if administered under the right conditions. Von Pettenkofer declared that his survival would prove once and for all that bacteria alone could not cause disease, that environmental factors and individual constitution were the determining factors in illness. The moment when von Pettenkofer raised the vial to his lips and drank its contents in a single, deliberate swallow was witnessed in absolute silence by the packed lecture hall. The taste, he later reported, was slightly salty and unpleasant, but not unbearable. He set down the empty vial, smiled at his audience, and calmly announced that he would document his condition over the following days to demonstrate his continued health. The immediate aftermath of von Pettenkofer's experiment was a period of intense anxiety and anticipation that gripped the entire medical community. Colleagues who had witnessed the demonstration spread word throughout Europe of the elderly physician's reckless gamble, while newspapers picked up the story and sensationalized it as either heroic scientific dedication or dangerous medical madness. Von Pettenkofer himself maintained a careful log of his physical condition, noting every sensation and symptom with scientific precision. For the first 24 hours following the experiment, von Pettenkofer experienced no symptoms beyond mild stomach discomfort that he attributed to anxiety about the outcome. His appetite remained normal, his bowel movements were regular, and his temperature stayed within normal limits. As the hours passed without the onset of cholera symptoms, his confidence grew, and he began to speak privately with colleagues about the vindication of his theories. The second day brought the first signs that von Pettenkofer's body was responding to the bacterial invasion. He developed loose stools and mild abdominal cramping, symptoms that could have been early signs of cholera or simply the result of digestive upset from stress and unusual diet. Von Pettenkofer documented these symptoms carefully, but maintained that they were minor and would resolve without treatment. By the third day, von Pettenkofer's symptoms had progressed to what could be classified as mild diarrhea, though nothing approaching the severe rice water stools that characterized full-blown cholera. His temperature remained normal, he showed no signs of dehydration, and his general condition remained stable. Most remarkably, he continued to teach his regular classes and maintain his normal schedule, as if to demonstrate that the bacterial exposure had caused no significant illness. After 5 days, without developing severe cholera symptoms, von Pettenkofer declared his experiment a complete success. He published a detailed account of his experience in the Munich Medical Weekly, arguing that his survival proved that bacteria alone could not cause disease. He theorized that his robust constitution, maintained through proper hygiene and environmental awareness, had protected him from infection despite massive bacterial exposure. The medical community's response to von Pettenkofer's survival was mixed and contentious. Supporters of the miasma theory hailed his experiment as a heroic vindication of environmental medicine, while advocates of the germ theory argued that his survival was either a fluke or evidence that the bacterial culture had been inactive. Robert Koch himself suggested that von Pettenkofer might have possessed natural immunity, or that the experimental conditions had not been optimal for bacterial virulence. Dr. Rudolf Emmerich watched his mentor's triumph with a mixture of admiration and scientific curiosity. As von Pettenkofer's closest assistant, he had been intimately involved in planning the experiment and had access to the same bacterial cultures that his mentor had consumed. Emmerich began to consider whether repeating the experiment would provide additional evidence for their theories and further establish the validity of environmental medicine. Emmerich's decision to repeat von Pettenkofer's experiment was influenced by several factors beyond simple scientific curiosity. He was ambitious and eager to establish his own reputation in the medical community, and a successful replication of his mentor's experiment would certainly bring him recognition. He was also deeply committed to von Pettenkofer's theories and genuinely believed that environmental factors were more important than bacterial exposure in determining disease outcomes. Most tragically, Emmerich was influenced by his emotional attachment to von Pettenkofer and his desire to prove his loyalty to his mentor's teachings. The young physician had built his entire career around von Pettenkofer's guidance, and the opportunity to demonstrate his commitment to their shared theories was irresistible. He may also have been motivated by a desire to silence critics who suggested that von Pettenkofer's survival had been mere luck rather than scientific validation. On October 21, 1892, exactly 2 weeks after von Pettenkofer's experiment, Dr. Rudolf Emmerich entered the same lecture hall where his mentor had achieved his controversial triumph. The audience was smaller this time, consisting mainly of medical students and junior faculty who were curious to see whether von Pettenkofer's results could be replicated. Emmerich appeared nervous but determined as he prepared to follow in his mentor's footsteps. Emmerich's preparation for the experiment was even more careful than von Pettenkofer's had been. He used bacteria from the same culture that his mentor had consumed, ensuring that the virulence and concentration were identical. He had fasted for 12 hours before the experiment to ensure optimal absorption of the bacterial dose, and he had arranged for continuous medical monitoring throughout the expected incubation period. The moment when Emmerich consumed the cholera bacteria was witnessed by von Pettenkofer himself, who had come to observe his student's replication of the experiment. The older physician watched with pride and confidence as Emmerich drank the bacterial culture, certain that his student would experience the same mild symptoms and rapid recovery that had vindicated his own theories. The first indication that Emmerich's experiment would have a different outcome came within 6 hours of bacterial consumption. Unlike von Pettenkofer, who had experienced only mild discomfort during the first day, Emmerich began to develop severe abdominal cramping and nausea that forced him to cancel his afternoon lectures. By evening, he was experiencing frequent loose stools and had developed a low-grade fever that suggested his body was mounting a more aggressive response to the bacterial invasion. Von Pettenkofer initially dismissed his student's symptoms as anxiety-related, confident that Emmerich would recover just as he had. However, as the night progressed and Emmerich's condition continued to deteriorate, the older physician began to feel the first stirrings of concern. He remained at Emmerich's bedside, monitoring his student's condition and offering reassurance that the symptoms would soon resolve. The second day of Emmerich's illness brought a dramatic escalation in severity that left no doubt that he was developing full-blown cholera. His diarrhea had progressed to the characteristic rice water stools, voluminous, watery discharges that contained flakes of intestinal mucosa and had the appearance of water in which rice had been boiled. The fluid loss was massive, and Emmerich began to show signs of severe dehydration despite efforts to replace lost fluids. Emmerich's temperature spiked to dangerous levels, and he began to experience the muscle cramps and weakness that characterized advanced cholera. His skin became cold and clammy, his pulse grew weak and rapid, and his eyes began to sink into their sockets as dehydration progressed. Most terrifying of all, he remained conscious throughout his ordeal, fully aware of what was happening to his body as the disease systematically destroyed his intestinal tract. Von Pettenkofer watched his student's deterioration with growing horror and disbelief. The confident physician who had declared victory over the germ theory just 2 weeks earlier found himself confronting the possibility that his survival had been nothing more than a deadly accident of chance. He summoned the best physicians in Munich to treat Emmerich, but the medical interventions available in 1892 were woefully inadequate for treating severe cholera. The treatment options for cholera in the 1890s were limited to supportive care and symptomatic relief. Physicians could attempt to replace lost fluids through oral rehydration or primitive intravenous techniques, but they had no effective medications to combat the bacterial infection or halt the progression of the disease. Opium was administered to control diarrhea, but this often worsened the condition by allowing toxins to accumulate in the intestines. As Emmerich's condition continued to deteriorate, von Pettenkofer was forced to confront the ethical implications of his role in his student's illness. He had not only encouraged Emmerich to repeat the experiment, but had provided him with the bacterial culture and supervised the procedure. The realization that his scientific hubris might have murdered his most loyal student was almost unbearable for the elderly physician. The third day of Emmerich's illness brought a brief period of apparent improvement that gave von Pettenkofer false hope for his student's recovery. Emmerich's fever decreased slightly, his diarrhea became less frequent, and he was able to take small amounts of fluid by mouth. Von Pettenkofer interpreted these changes as evidence that his student was beginning to recover, just as he himself had done after the initial symptoms. However, this apparent improvement was actually a sign that Emmerich's condition was entering its final, most dangerous phase. The temporary reduction in symptoms occurred because his intestinal tract was becoming so damaged that it could no longer produce the massive fluid losses that characterized acute cholera. His kidneys were beginning to fail from dehydration and shock, and his cardiovascular system was struggling to maintain circulation with the severely reduced blood volume. The fourth day brought a catastrophic deterioration in Emmerich's condition that left no doubt about the outcome. His blood pressure dropped to dangerously low levels, his pulse became barely detectable, and his skin took on the blue-gray color that physicians recognized as a sign of impending death. Most horrifying of all, he began to experience severe muscle cramps and convulsions as his electrolyte balance became fatally disrupted. Emmerich's final hours were marked by excruciating pain and terror as he felt his body systematically shutting down. The muscle cramps were so severe that his screams could be heard throughout the hospital, causing other patients and staff to flee the area in horror. Von Pettenkofer remained at his bedside, holding his student's hand and whispering apologies that could not undo the damage that had been done. Dr. Rudolf Emmerich died on October 26, 1892, at 3:17 a.m., 5 days after consuming the cholera bacteria that his mentor had survived without serious illness. His death was agonizing and prolonged, a textbook case of cholera that demonstrated the disease's capacity for causing unimaginable suffering. Von Pettenkofer, who had been so confident in his theories just weeks earlier, was left to confront the reality that his scientific arrogance had killed the young man who had trusted him most completely. The autopsy performed on Emmerich's body revealed the full extent of the damage caused by the cholera bacteria. His intestinal tract was severely ulcerated and inflamed, with large areas of tissue death that had allowed massive fluid losses. His kidneys showed signs of acute failure from dehydration, and his heart muscle was damaged from the prolonged shock and electrolyte imbalances. The bacterial culture that had caused only mild symptoms in von Pettenkofer had literally liquefied Emmerich's intestines and killed him through a combination of dehydration, shock, and organ failure. The medical community's response to Emmerich's death was swift and devastating for von Pettenkofer's reputation. The young physician's agonizing demise provided dramatic evidence that cholera bacteria could indeed cause fatal disease, regardless of environmental factors or individual constitution. The fact that two men exposed to identical bacterial cultures had experienced such different outcomes suggested that factors other than environmental conditions, perhaps genetic immunity, previous exposure, or simple chance, determined disease susceptibility. Von Pettenkofer's attempts to explain away his student's death as an anomaly or the result of experimental error were met with skepticism and outrage from colleagues who viewed Emmerich's sacrifice as unnecessary and preventable. The elderly physician found himself increasingly isolated within the medical community, his theories discredited, and his reputation tarnished by his role in his student's death. The psychological impact of Emmerich's death on von Pettenkofer was profound and lasting. The confident physician, who had once dominated German hygiene, became a broken man, haunted by guilt over his student's fate and tormented by doubts about the theories that had guided his entire career. He withdrew from public life, rarely appearing at medical conferences or publishing research, and spent his remaining years in relative obscurity. Robert Koch and other advocates of the germ theory used Emmerich's death as powerful evidence for their position, arguing that the young physician's fate demonstrated the lethal potential of bacterial pathogens. The tragic experiment became a cautionary tale about the dangers of scientific hubris and the importance of ethical oversight in medical research. Modern medical science now understands that von Pettenkofer's survival was likely due to a combination of factors that protected him from severe cholera infection. He may have possessed natural immunity from previous exposure to cholera bacteria, or his advanced age might have provided some protection through mechanisms that are still not fully understood. His robust general health and excellent nutritional status probably also contributed to his ability to fight off the infection. Emmerich's death, by contrast, demonstrated that cholera bacteria are indeed capable of causing fatal disease in susceptible individuals. His youth, different genetic background, and possibly different immune status made him vulnerable to the same bacterial exposure that his mentor had survived. The tragedy illustrated the unpredictable nature of infectious disease and the dangers of drawing broad conclusions from limited experimental evidence. The ethical implications of von Pettenkofer's experiments continue to resonate in modern medical research. His willingness to risk his own life in pursuit of scientific knowledge might be considered admirable, but his encouragement of his student to repeat the dangerous experiment violated fundamental principles of research ethics. Modern institutional review boards and ethical oversight committees exist largely to prevent such tragedies from occurring. The development of effective cholera treatment and prevention has made von Pettenkofer's deadly experiments unnecessary for advancing medical knowledge. Modern oral rehydration therapy can save the lives of most cholera patients, while improved sanitation and water treatment have largely eliminated the disease from developed countries. Vaccines are available for high-risk populations, and antibiotic treatment can shorten the duration and severity of illness. Von Pettenkofer's contributions to public health and sanitation should not be entirely overshadowed by his tragic final experiments. His work on urban hygiene and disease prevention saved countless lives and established principles that remain important today. However, his stubborn refusal to accept evidence that contradicted his theories and his willingness to risk human lives to defend his position serve as cautionary examples of how scientific ego can lead to tragedy. The story of von Pettenkofer and Emmerich reminds us that scientific progress often comes at a human cost, and that the pursuit of knowledge must always be balanced against ethical considerations and respect for human life. Their tragedy illustrates the importance of humility in scientific inquiry and the dangers of allowing personal pride to override evidence and common sense. Dr. Rudolf Emmerich's death, screaming in a Munich hospital bed, stands as a permanent reminder that some scientific questions should never be answered through human experimentation, no matter how confident researchers may be in their theories. His sacrifice contributed to the eventual acceptance of the germ theory of disease, but at a cost that should never have been paid. The doctor who drank cholera and lived, and the assistant who died screaming, teach us that scientific truth is not always kind to those who seek it, and that the price of knowledge can sometimes be measured in human lives. In the archives of medical history, Their story remains a sobering reminder that the pursuit of scientific glory must never come at the expense of human dignity and safety. Next time, we'll explore a case that challenged Victorian understanding of human anatomy, a patient whose condition would force physicians to reconsider everything they thought they knew about the limits of surgical intervention and the body's capacity for survival. If you found this tragic tale as compelling as I did, consider subscribing to witness more extraordinary cases from medicine's most controversial chapters. Each week, we delve deeper into the archives, where scientific ambition meets human tragedy, where theories are tested with blood, and where the past reveals the true cost of medical progress. Until then, remember that within each of us lies the potential for both great discovery and terrible error, and that the difference between the two often depends on our willingness to acknowledge the limits of our knowledge and respect the lives that hang in the balance.